From COVID, we are going to miles apart, completely different realm. We know sex as, since millennia, we look at sex as something which is binary, either male or female. But probably it is time that you have to appreciate that things are changing, the outlook is changing, especially by the endocrinologists and all over the world, that it may not be a binary way of looking at this one. It may be a sort of spectrum. And there cannot be a better person than Professor Majumdar, who have been working on this particular hypothesis and this particular outlook for quite some time and published quite a lot. And he is a professor of endocrinology at KPC Medical College. He's also a conjoint professor of public health in the School of Medicine in the University of Newcastle at Australia. He is a fellow of the American Association of Clinical Endocrinologists and published quite prolifically. So I wouldn't stay between you and Professor Majumdar to deliver this very important talk. Professor Majumdar, please.
Good morning. Am I audible and my slides are visible, I think?
Yes, sir.
Yes.
Okay, thank you. So I'm going to talk about the queer group as Dr. Pandit has already introduced to you. Now we are not looking at only the two sex, which is basically the customarily and conventionally divide the mankind, but we are looking into the spectrum of the issue, and this is queer. So I'll just go through this, and I do not have any conflict of interest. I treat the adult patient, and all the pictures which I'll show have the consent from the concerned person. Now I'll discuss about some introduction. Then I'll talk about my experience. I'll discuss about what we mean by genderqueer group and why I am talking about this, the health risk. And lastly, I'll wrap up with some take-home message. Now this is a patient which came to me, a 24-year-old woman, presented with a history of strong desire to be a male, and she was assigned female at birth, but she preferred to dress like a boy and playing boyish games. Her behavior was encouraged by her parents as they did not have any male children. She grew up, she started to get attracted toward women. She used to constantly feel that she was trapped in a wrong body and started developing symptoms such as worthlessness, anxiety, depression, suicidal thoughts, and suicidal attempts for the last 4 to 6 months. She expresses the desire to get operated so as to become a man. So this simple case actually let you understand that some of the people have this problem of the sex or the gender with which he or she is assigned at birth. So there may be a possibility of incongruity between the sex assigned at birth and the preferred sex of that particular person. Now this is, we call at gender incongruence, means the incongruity between one's assigned sex at birth and one's self-perceived gender. And when this kind of incongruity gives some distress, then we call it as gender dysphoria. Now this concept that we cannot divide the whole humankind into two different groups, male and female, is there since the ancient time. As you can see, that a lot of mythological stories, lot of literature, there are a lot of paintings, there are a lot of sculptures in which you can see that this concept was there since ancient time. And if you, not only on this part of the world, but if you look into the Western country as well, this is a Greek marble of 2nd century BC. And if you closely look into this figure, you'll find that this particular figure had both breast and the penis, indicating that this actually customarily don't fit with our traditional definition of male and female. So therefore, if we ask this question that how many types of gender we have, as Dr. Pandit has already pointed out, that possibly we cannot divide the whole human kingdom into the two group of male and female. Rather, we should think that not only the male, female, but we have to think about the third aspect or third gender or kinner, and as we can call it in the Western terminology, the queer group. Now, queer group does not mean that they have only one type of gender, but there are many people, those who do not conform to that of the traditional definition of male and female, are actually clubbed under the heading of the queer group. Now, this is the way by which actually the sexual identity develops. It starts from the chromosomal sex to the gonadal sex, then the genitalia, external genitalia or phenotypical sex. Then they actually check up the gender role, male or female gender role, and then we call them as man or women, and that is on the basis of the chromosomal sex, gonadal sex, phenotypical sex, and very, very importantly is the gender identity or the gender role they take up in their life. So therefore, in most of the situation, this is actually in line, or we call them straight, but sometimes it happens that there is an incongruity between the chromosomal sex, gonadal sex, phenotypical sex, and the gender identity. As you can see in the left panel, if there is XY testis male genitalia, but if adopt a female gender role, we call them transgender women. And on the other hand, in the right panel, if you see the chromosomal sex is XX, gonadal sex, ovaries, female genitalia, male gender role, and then we call them transgender man. So what we actually call them as gender identity disorder long back. It was a psychiatric diagnosis when there is a strong and persistent cross-gender identification, which was combined with a persistent discomfort with one sex or sense of inappropriateness in the gender role of that sex. And this terminology was later changed into the gender dysphoria in 2013. And now people believe that it should not be placed under the heading of the mental and behavioral disorder. It should be outside. And now we have given a new terminology that is gender incongruence. If I ask this simple question, how do you describe your gender? I think almost all of us can give a very clear and straightforward answer, but some of the people in the community may have different answer and very confusing answer. So it may be varied as people, and you just cannot tell the gender of a person from looking, and it is often complicated to figure out. And if you want to know about the gender, the simple way to do it is to ask and ask. You just cannot just figure it out looking from the person. Now, coming to a little bit of my experience among this group of people, this is a young man came to us for the gender affirmation therapy, and we have started the gender reaffirmation therapy in this young boy, and after giving the hormonal therapy and surgery, and you can see that we can call them a trans feminine. Similarly, if you look into this young lady who presented with us with a devastating breast surgery in an endeavor to become a man, and then after coming to us, a redo surgery was done, and the gender reaffirmation therapy was started, and we call them trans-masculine. Now, this is a young lady of 32 years from Bangladesh who consulted our endocrine clinic for female hormone therapy. She ran away from her family at the age of 16, joined a Hijra community. She underwent castration 14 years ago by a quack inside the Hijra community quarter in remote village of Bihar. And if you look into the after the operation, you can see there is no genitalia at all. Now, if we look into our experience from the Eastern India, we find that the many people come to us after prior castration and after prior mastectomy operation. Now, this is a young boy came to me at 2001 when he has basically puberty gynecomastia. His parents were apprehensive about that, but he was not. He lost in follow-up, came back to me in 2010, And when actually I found him is basically confused about his identity, depressed with suicidal thoughts. So we, after consultation with the psychiatrist, we make a diagnosis, and then actually we started the hormonal therapy and gender affirmative surgery. And you can see in 2013, she was sitting in the examination couch with so much confidence in front of me. This is another young person who transmasculine, started hormone in 2011 at the age of 20, mastectomy at 2012, and interestingly that he came to me in 2015 with his girlfriend. And you can see, if you look into the perspective of these two young person, this one is basically have the biological sex of female, gender identity manness, but sexually or romantically attracted to a woman. On the other hand, this young lady, who is basically a normal female, whose biological sex was female, gender identity woman, but attracted towards not man, but towards the masculinity. This is a young lady of comparative literature, assigned female sex at birth, sexual orientation female, mentally and physically attracted to female. So her mother was worried. She was not interested to change her gender. She had anxiety and thought herself alone and insecure. This is a young boy of 20, student of commerce, demanded that he was a gay. Assigned male sex at birth, sexual orientation male, mentally attracted to male, disliked interacting with women. His mother was worried. He had no anxiety, but a huge challenge for his parents. This is a young man of 20, tendency to talk excessively. He had woman-like behavior, woman-like walking, gesture, physically attracted to female. His mother worried about hormonal defect. And she told me that, doctor, you give him some male hormone because he lacks the male hormone, and that is why he behaves like a woman. He was bullied by the peers since adolescence for female mannerism. He is not interested to change his gender, but he had a suicidal attempt, a huge challenge in front of us, hanging twice, survived. Now, this is a young lady, 26 years, diagnosed as congenital adrenal hyperplasia with salt wasting crisis at 10 days of age, karyotype 46XX, clitoroplasty done at the age of 2 years, reared as girl, spontaneous puberty at 12 years, now desires to be a male and adopt a male typical behavior. And this is another interesting story. This is basically the taller one actually was male, wanted to become female, and the shorter one is basically a woman and wanted to be a male. So during their follow-up period in our clinic, they actually got romantically attracted to each other. So if we look into their perspective as far as their attraction is concerned, this is a biological, this patient has got a biological sex female, gender identity manness, but romantically attracted to femininity and not towards a female. And this is basically a biological sex of male, gender identity is womanness, but romantically attracted to masculinity and not towards man. Now, this is another interesting relationship between these two. And this is the first one, the taller one actually wants to be transformed from male to female, and therefore the biological sex is male, gender identity is womanness, and romantically attracted to female because this girlfriend is basically perfectly a normal woman. And if you look into her perspective, the biological sex is female, gender identity is womanness, romantically attracted to both sex. So therefore, if we look into this question that how many types of gender we have, and we have on two extremes, we have the man and women, but in between we have to place the other people, and we have to conventionally place the trans masculine and trans feminine in between the two. But even then we are thinking in the line of binary concept of gender. Now we have to place the other people also in between them, and therefore they consist of the queer group, those who fits between the two extremes, but we have to consider them under the heading of third gender or gender queer, and they consist of 0.6% of the population. Now this is basically prevalence study data available from other parts of the world, but we do not have prevalence study in our country. As far as last census of 2011 is concerned, the government says that we have roughly around 5 lakh transgender people in our country. Now coming to the gender queer, now is basically a spectrum disorder of gender identities that are not exclusively masculine or feminine identities, an umbrella term for people who are outside the binary concept of female and male, and anyone whose gender identity is outside this standard or classical definition of male and female is clubbed under the heading of genderqueer. You must have seen them, these people on the roads, and they consist of the third gender as Hijra, the officially recognized third gender in India. But we also have intersex disorder, transvestite, transgenders, and the genderqueer. Anyone who is not heterosexual or cisgender is basically genderqueer. You must have heard this terminology LGBT. They consist of lesbian, gay, bisexual, and transgender, and they are further extended the terminology as LGBTQ because many of them don't know how to identify their own gender, so they remain under the heading of questioning. Now we have the two-spirited people as well. So now it is LGBTQ2, and then we have the intersex, asexual, and ally. So the terminology has extended further. And don't forget, we also have bigender, a person who moves between femininity and masculinity in the same lifespan. And therefore, this basically a very big queer group. Now, if we look into this slide, that actually gives or summarizes what I'm talking about. Now, we have the biological sex, which depends on the phenotype, and we also have the identity, which lies in our head. It is basically a psychological sex. Now, the biological sex and identity may not match, and then we have attraction, a sexual or romantic attraction towards women, female, femininity, maybe men, male, or masculinity. And these three, identity, biological sex, and attraction, ultimately govern the expression, and they may not actually align, and there may be a possibility of various permutation and combination as far as this identity, biological sex, attraction, and expression is concerned. So if I look into the category of the people, if I consider the straight male and straight female at the top and bottom of the list, if I keep the middle as questioning, where actually they don't understand or they don't appreciate their own identity and attraction, then we have a lot of people in between the two, the gay, bisexual male, transmasculine, asexual male, asexual female, transfeminine, bisexual female, lesbian. So basically a rainbow curve or many shades, so it is often called as rainbow community. Coming to why I am talking about them, what is the health risk? And you can see the psychological health of non-binary genderqueer people is a very, very important issue. They suffer from post-traumatic stress disorder, anxiety disorder, major depressive disorder, bipolar disorder, and very, very importantly, the substance abuse disorders. So if we look into another important aspect, that is the suicidal thoughts and behavior, and this, if we look into this study published in 2019, the average suicidal ideation found in among 46% of individuals, and suicidal attempts about 27% of individuals. And we do not have much data from India, but whatever one or two small publication is there, they actually confirm with the similar prevalence of suicidal attempts. And now how we should manage them. First, we have to understand the client goals. And let me tell you, this goal actually keep on changing. And that is a very, very important challenge in front of us. So we have to make a lot of compromises. And also on part of the patient, they also have to do a lot of compromises because all ideas and fantasies cannot be fulfilled with the modern medicine. And that is why we have to work with the uncertainty. Let me tell you that medical transition does not legitimize or delegitimize anyone's gender, because we have the Nalsa judgment, which is there from 2014. Supreme Court has gives the right to self-identification of the gender as male, female, or third gender. So if you look into our publication, we have found many people who come to our clinic, they have a very high degree of lost in follow-up. So 25% people, they don't follow with us and remain under the care. So the last important part is how the diabetes is associated with this, because the fact some of the people, those who have this kind of disorder or the gender incongruity, they also have the diabetes. And when we start therapy, then we have to consider that this gender reaffirmation therapy have an impact on the management of the diabetes. Giving testosterone therapy actually increase the insulin sensitivity. On the other hand, when you are giving feminizing therapy, there is a possibility of worsening insulin resistance and complicate the treatment of the diabetes mellitus. So we very recently actually published this consensus statement about the medical management of gender incongruent individual. And very recently, I published the quality of life among gender incongruent individual from the Hijra community, which I found is not very bad. So what is the take-home message? I would like to tell you that the non-binary gender identities should be recognized by the healthcare service system. The second is that the specialized training for healthcare providers to become gender literate is the need of the hour. And the guidelines should be revised to include not only the option for the trans women and trans men, but also there should be option for the other gender queer people. And we have to create a welcoming clinical environment, not only for the transgender individual, but also for non-binary gender queer people to disseminate right information and reduce the health risk. Lastly, I'll end with the quote from Tagore, Aro alo, ei noyone prabhu dhalo. Thank you very much.
Thank you, Professor Majumdar, for taking us through these poorly lit alleys of a different world. He had made us partially literate on this gender incongruous issue, but I'm also quite acutely